Hello there, this is yours truly. Let me see if oh no, it's not. Let me switch on my headset and let me put in my headset and we'll sync it because it's background noise that I know is picking up. I'm right next to my neighbor, and so this is great. Great news, guys. Great news. Going to tell you why in just a sec. Give me a second to pair my device. Okay.
Go to my other app, make sure we switch over. It is switch. Okay, the title of this message is Congratulations, we have just gotten new information from the hospital that a program called Uber Health, etc. Repeat, Uber Health, Uberheath, okay, Health, has been created, and this Uber Health program that has been created picks up HIPAA, and what you know what HIPAA is, HIPPA. And for all of us in cybersecurity, which I am in, I understand what HIPAA is. That's my job to protect. That's why I know I didn't do anything wrong when I showed the video of a person in a residency that I'm a resident of. But that's a whole nother statement. I'm not going to debate with a stupid woman. But here's the situation. Over the last 1, 2, 3, 4, 5, 6, 7, 8, maybe 10 to 15 weeks, let's do the math. If I could do the math, April. Just say I didn't go to my first appointment till like middle of June. So we could say June, that's 1 month. July is 2 months, 8 weeks. August is 3 months, that's 12 weeks. 4 months would be 16 weeks. 5 months would be 20 weeks. So that's June, August, September, October, November. So that's 5 months plus 20 weeks. I'm in December now. So roughly 22 weeks I had been, needing to go to the doctor. And you really should be going to the doctor every single week. Every single week. Do you know a social worker was supposed to set me up on those visits? Yeah. I just escalated as an intelligent black man does via email. And because of the escalation, I got things done. When I did nothing, when I was quiet, when I went to Miss Yukubiku, a person who's not American, who doesn't understand the discipline that we need, her mindset was, I'll get around to it. 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 And of course, we got a house of one, two, three, four, maybe 8 or 9 people, and they're in very bad condition, very bad condition. I was too. Thank God for it, healing power of God. And so one of the things I noticed when I first got here was I'm out here in Douglasville, but I'm going to Grady. How you put me out here in Douglasville? You will put me closer to Grady. And I have a list of all the actual health homes in the city of Atlanta and also in DeKalb and also in every county of the state of Georgia because I escalated. And the funny thing about it, I could have gotten online for free, but the website I went to the wrong section of the website. So I couldn't have downloaded the data. But once I talked to a human being, they told me what the data was. I got the data for free because by law, you're supposed to get it. So once I did that, I started making phone calls, and I need to make some calls now. Matter of fact, to talk to some people. But I said what I wanted to do was get my vehicle so I could drive to the places to talk to them in my car. If I can drive my car, I can get anywhere. And if I can get out the car and get into a wheelchair, I can go anywhere, right? Because a wheelchair would transport me around. So that's what I want to do. So I go online and I get my license, registration, insurance all squared away. My car is sitting in my ex-girlfriend's home. She's taking good care of it. And it unfortunately ran out of battery because the car wouldn't be started because she didn't want it started. She didn't care about that. And I had no insurance because I was unemployed and had no money until around August of this year when I went back to school to get my degree. Okay. Thank God for that because if not, I would be sitting probably in this place effed up and screwed because I would have no money to get the insurance for the car, no money to get the vehicle, and basically I'd be starting I'd be sitting here eating, you know, horrible food and having high blood pressure and never get checked. And I probably would not have even escalated to get these people to work because I, as an intelligent black man, would have just been like, well, I guess I need to suffer here. I guess I just need to suffer. Now, this is a guy who's been educated, who's been out on his own up until the age of 49. He may not ever live as a basic, patient. He had lived with his mother, he lived with people, but he was always trying to get things accomplished. Only bad thing he did wrong was he did not take care of his body. He did not eat the right foods, and of course, the complications about high blood sugar or diabetes, and has helped has hurt me. So I have my kidney test on Tuesday. So over the next few days, I'm drinking lots and lots of water because my kidneys are going to flush out that doggone sputum. So looking at my kidney output right now, I see it's dark. Ah, so I'm going to be drinking lots of lemonade water for my kidneys that will operate at 50%. They get to 60%. But the damage that I did to my kidneys when I went to the hospital and the nursing home and the lack of getting proper water. Remember, we was in that damn nursing home, and instead of somebody saying, bring Howie water, they didn't. Why? The more water we drink, the more urine we urine. The more urine we urine, the more diaper changes we have to have. The more diaper changes we have to have, the more work they do. But the consequence is your damn kidneys. Your damn kidneys. Now, what happens when you lose your kidneys? Dialysis. What happens when you lose your kidneys? Dialysis. That means that machine sucking your blood out your body for 5 hours, 3 times a week. You know how many millions of people in Atlanta are on dialysis? Tons of them. It's a matter of fact, that's what they expect to happen. F those mother suckers, okay? Why I gotta lose my kidneys because you don't want to help me? So, thank you, Lord. After going down the pike and having the doctor tell me that my kidneys are operating at a 50% capacity, and someone's calling me back. Hold on a second. Someone's calling Miss Rogers. 1 second. I had to be professional with her because I knew that she had the job and they'd be listening to her. So I switched from code sweet. I could talk black, but then I realized you better talk white because you know people listening to you. She laughed because she knew she's like, oh, I know this guy. This guy is. She knows. Like he probably said, she like this guy. No. So she put it in for tomorrow, to Wednesday at 8 o'clock. And why I did that was because this is Uber, and you got to put that in now. So because she put it in now, that's going to give at least 24 hours for people to say yes to picking me up. If she did it tomorrow afternoon, there might not be a guarantee that someone's going to pick me up. There's a higher probability that someone's going to pick me up now because today's Monday, and you're putting it in on a Monday for Wednesday morning. So all I got to do is get up at 8 o'clock and now and be ready on Wednesday, and then praise God, I'm good. But I wasn't mean to the lady. I was being assertive. I was being I got something. Got to be professional now. Got to let the we got know whether you're white or black. You got to be professional. Okay. She knows that. She went to college. I went to college. We know. So yeah, I mean, wheelchair. I said, yeah, I can, but I'm just not able to walk all the way because I mean, it's like a complication. It's like a little bit of I hate to say it, numbness in my body, feet, man. It really pissed me off. Complications of going to the hospital. I think. Oh, another call. 1 second. Someone else calling me. Okay. Oh, no, that's Grady Health. That's the Grady Health. Oh, 1 second. 855. Hello, my name is Mr. Howard. How can I help you, sir? Ma'am. Awesome. Thank you. All right. That is awesome. Okay, so what you just heard, microphone, was Uber Health, not my Uber app, but Uber Health. So when I had to call her today, I was trying to let her know the Uber app is different than Uber Health. I said, I'm Uber driver. And so Is it coming on my app or is it going to come from you? And it's coming from them. It's going to my phone. So in essence, they're going to call my phone. So what I'm about to do right now is I'm about to play the app. The chat GPT question I asked was, what is Uber? What is Uber Health? And how does it work with hospitals? Yeah. So the number is 214-506-0548, and it tells me to ride. So I'm gonna go into my phone, update this with a label called Google Health. So in the future, God willing, if I set up these trips, they'll come to me wherever I go. So if I don't drive my car, I can have them pick me up. You via Uber. Yes. Now, what's pissed me off is this could have been done and set up a month in advance, 2 months in advance, 3 months in advance. So you're listening to me. 4 months in advance. Are you listening to me? 5 months in advance. Matter of fact, it can be set up for every one of these people here. Questions: do they know? The answer is probably not. So it's called Uber, Uberhealth, rideshare, IDE, hospital, uh, rideshare. So this is not the regular Uber. This is a medical Uber. Okay, which means, and I'll copy this whole thing. You got to paste this twice into my system. Oh damn! I didn't. I did. I copy it. I did. I copy. Hope I did. Let's see. Let's see. Did I copy it? No, you did not. I tried to copy and paste, but I got to type it twice. So Uber, all caps. Stop typing it. Uberhealth. Ride, SHARE. Social worker, scheduled. What is that? Scare. Alexa, how do you spell scheduled? I was like, I should know how to spell that word, but I mean, I have a little issue with spelling that word, which is ridiculous. But yeah, see, didn't even say that. So yeah, I tried to say it, but I didn't. So type in one time. UBR, not V, UBER, Uber, health, or hospital, say hospice, RIDE. Here's the reason why this is happening. I'm gonna tell you in a minute why. That's why Uber Hospital ride share social worker. This is awesome because technically I could be here and I could have stayed here and it's third time. Oh, that's one. I add it one more time. This pisses me off. Uberheal to okay HOSP RIDE ride schedule SCHEDULER. So it's called a scheduler. What that means is it's going to schedule this. That's the system. It's an automated AI. So it's basically called an automatic AI, and she plugs it into the system. And why this is amazing, microphone, is because what the companies did, what CareSource did. CareSource could not keep paying, could not give us a rideshare method. There's a company called Avita that traditional Medicaid was paying for people to get to and from the hospital. They stupidly canceled it because Republicans decided to close a section of the bill paying for that. They're evil. Congress, Democrats, Republicans, both sides of the House, and federal state evil. So, how does these poor people get to the hospital? They came up with another method. And so now I'm going to play what Uber Eats is, and you're going to hear it. So, it gives me a link. It says Uber Eats scheduled for 7 o'clock a.m. You'll receive a text when the driver's on its way. And by taking this ride, I have to take the turns. I know that, of course. I'm an Uber driver. So if you think I want to take, listen, I pick people up. So I believe I'm great. But the great part about it is that this should have been happening in June because I could have all my appointments scheduled for the next 5 months. Bam, boom, bop, boom, bop, boom, bop, boom, bop. Right? I got people right now, and they live in this place right now, and they're so messed up because the lady did not tell them about Uber Eats. I don't Uber Health. I don't think she even knows what Uber Health is. So, microphone, since you're picking up on my headset, I'm gonna play what ChatGPT has said, and since the sound is coming from my microphone and not through the phone, I'll bring it really close to my ear so you can hear it. And I'll read it to you. You don't have to speak it. I'll read it to you. Let me use my own voice. Here we go. Uber Health isn't just another Uber app feature you toggle on your phone. Ah, check that out. It's not an app. See, that's why I was asking Leah. I said, "Is this an app?" And she was like, I don't know what it is. And I said, "Of course you don't." But see, I knew the question to ask. She called me back within about a minute and told me I got it done. So when you're educated, you know what to do, you make people work. Whether you're black or white, red or yellow, when you know how to communicate, people move as you want them to move for you. So it's a health sector transportation logistics platform designed to let health hospitals arrange rides on behalf of patients. That's me. So when I missed all those appointments to the doctor, they could have been arranging a ride for me, but no one told me why. Because the lady who was a social worker for me at this place never contacted me. I came to this place because Mary said that they did a contract. They never told me when the start of the contract ended. I had no clue. It wasn't only until I got her pissed off that she said the contract ends. Fine, no problem. But I didn't care about that. Went above that lady. I drove to the place. I tried to meet this woman. I called her. She said, I'll call you back. She never called back. I went above her head to the doggone director of that woman. And that woman, hopefully, she got in trouble for it. Perhaps she did. And then all of a sudden, another guy calls me named Charles Akota. He then basically says to me, well, we can't help you. Blah, 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 blah. Fine. I then email another email, and Long, as he said earlier, thank you. That Long got your behind to call me, didn't it? And he gives me a phone number to the social worker. Why else did I get a phone number to the social worker like 7 months after I've been here? I call the social worker. Social worker is a Zeta. Social worker is a black Zeta, educated black woman, my age, and has a daughter, a son going to college. So she's about 50. Now, I am not the typical ninja that a lot of people think we black people are. I'm educated by white standards by far. And so when I communicate with her, she looked at me on the phone like, okay, he's a Sigma, but she's not a real Greek. She's a graduate level Greek. So that means that you joined it for the benefits of Zeta, not for the college experience. So you don't really know what true Zeta is. But anyway, back to my point. So after that experience, uh, quote unquote, being having a call with her, I called her back on Friday, left a long voicemail. Realized real quickly, girlfriend got too many calls. She don't got time to pick up the call, so she's getting calls, bam, 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 bam. So I said, boom, call her early this morning, no pickup. Left another voicemail, bam, bam, bam. Called a few minutes ago, picked up. And then boom, we had a nice conversation, very contentious as typical black women are. But when you communicate with direction and straightforwardness, they calm down, they listen to you. Because what I did, I asked her questions. I did exactly what women do. I questioned her over and over, and all she could say is, "I don't know, I don't know, I don't know." Now, what does that make a woman feel like? Stupid, don't it? So what that woman did, she went and found out. But what I do, I went to ChatGPT, and here's what it says. Health sector transportation logistics platform designed to let healthcare providers arrange rides and services on behalf of patients. Uber. So because of the fact Uber is taking over the game, why would you pay for a shuttle when you got Uber? All you got to do is get a discount between Uber and your hospital. And if the hospital is doing 1,000 rides a day, they lower the price because they got 1,000 rides. That's money overall for the company. That's like what that guy said online the other day. I was listening to my old job, and Mr. Plaskett was talking about how well we contract to get a certain amount of hours that the company, the project is going to be. And if you complete half the project on time, we get half the money. You finish the remaining half of the project, you get the rest of the money. So because it's a very small company, you must do the work. But the problem was, like my situation, I was not allowed to do the work because um, one, they gave me old projects that they thought I knew how to do, but I never did a full, complete deletion or upgrade. My job was to build new stuff. So being an engineer that built stuff and not an engineer that upgrades, it was the wrong job for me. And I realized that clearly I was not the right job for me. So then they let me off and they fired me. But I understood what the man said, and as I was listening to that, I had my iPhone with me, and I recorded the whole session without them knowing about it, which is great. And I played it back on my iPhone, uploaded it to the cloud for me to just remind myself. Because sometimes, it was my very first mega firing in my career as an engineer, and so I wanted to learn what to do. So anyway, back to what's going on. So they'll be coming up on 7 a.m. on quote unquote Wednesday morning. They just sent me a confirmation email. Amen. Confirmation email. So all I gotta do is be ready at 7 a.m., which means get ready at 6, which means be outside that door at 7. I ain't gonna be late. Now it's gonna be cold now. Remember, we're talking 13 degrees, probably 14 degrees. So we're gonna have multiple layers on and we'll be ready to rock and roll. But the good news is I get my doctor's appointment. Now, the other question is, after I get there, how do I call them to pick me up? Because that's another question. So I probably need to ask that question. That's a great question. Because what happens when they need to pick me up? I know, right? Uh-huh. So that's a great question. So let me give her a call right now on the phone because I mean I've never done this before, and that's a great question. So let's go to voice because I may have another appointment the following week, and I don't know. I gotta do that real question, Miss Rogers. So I'll call her right now on my phone, and I'm gonna ask her this question, and then I'm gonna get it to thank her, let her know I got the message. Hi, Miss Rogers. I want to let you know I got the message on my phone. I just want to thank you so much. I just had one little question. Um, how do I get a ride back to my home? Just call. Okay, so I have to call that number and just let them know. Oh, I tell the nurse to give you. Okay, we'll do. We'll do. Okay, thank you so much. That's all I need. Have a wonderful day. All right, so Black Sister was told. She explained it to me. Oh, shut up. I don't know why I call Shay. Stop. Call all these people. I don't know. Accidentally tapping the phone. Excuse me. So, as you did an educated man do, you asked the process. You got the question, and that's what women will do. And again, one tragic thing about black women is they don't really say that process. I think she thought I was going to just be like sitting out there doing nothing. No, this Negro know what the hell he's doing. He's a Sigma. What the Christ you think? Again, she probably thought it was some dumb ghetto ass signal, but I know, baby, this man a powerful signal. I ain't gonna play around. So basically, what's gonna happen is we're gonna go and we're gonna get through the process. That means that I can go get my get my stuff from the Kroger, and then basically I go back to the hospital, go back to the doctor's office and say, hey, nurse, can you please call the lady, and she'll then set up again to pick me up. Praise the Lord. Now, here's the other thing. I got a canceled appointment for the hospital this week. So if I pass that, I need to go. And I guess the last question is, what's the phone number for the social worker at the hospital? Because she's never sent me the name of the social worker at the hospital. See, I mean, once again, so many people she got to deal with. She just don't have a lot of time. So I've been talking to her. And I sit in a lot of stuff. You. Not one response back. So we need to go again. Give her a call tomorrow. Don't blast her with too much today. I've already worked her behind. But she's typical black woman. She thinks, I'm the boss and you ain't the boss. You're just a black woman that made a child, probably single. You ain't married. Definitely because y'all don't know how. Y'all just make babies. Y'all don't know how to keep so married because you don't know how to follow men. But anyway, let's break it back on down. So she says, think of Uber Health as a HIPAA enabled transport dispatch system that lets clinical and administrative staff schedule or request non-emergency transportation deliveries for you that might not be able to use a standard Uber app on their own. Whoa. Well, I could use the standard Uber app on their own. Here's what it is. The key pieces are non-emergency medical transportation. There it is. Because CareSource said no, you're not getting NEMT. This was the backup to it. Remember that the lady told me call CareSource. I called CareSource back. CareSource said no, we're not going to do it. I text her back that information. She did not respond. Then I call her back the next day. She says we'll set it up for you. My intelligent black man did all that. So it says healthcare organizations can book rides to and from appointments for patients, caregivers, or staff without the rider needing the Uber app or even smartphone. Amen. Common communications go to text or phone call. So what that does is that in essence, all these people here, they don't have smartphones. They could get Uber app to and from the doctor. The question is, will the lady trust him to get one? See, you got to be willing to be, I hate to say it, you got to be willing to let someone go on their own. Most of the people here can't go to the doctor on their own. So, in essence, that's what Miss Mary's doing. Exactly. She's accompanying them to and from the doctor. That's how it was when I first got here. It's not that way now. Okay. Accessibility and assistive options. You can get a wheelchair accessible vehicle. It's called a wheelchair accessible vehicle, which meets ADA specs, or use third-party trained drivers. And that's what's going to probably do, a third-party trained driver. But you could do a wheelchair vehicle. I have a wheelchair, so it may bring the wheelchair vehicle where I get into the vehicle and lift me up, or they may basically do a regular Uber. I hope they do the wheelchair vehicle because that'd be cool. I can actually try that for the very first time. In addition to rides, they said they can handle same day prescription delivery. Oh my God. That means that the prescriptions that I needed delivery, they could have done that if I had social work on my back. Okay. Now I why this is important. I'm gonna be using that social worker when I go where the next place I go. Now that I know what this is, guys, I'll be using this until I get a job and I'm able to take care of myself. All right. Yeah, Uber Health has powerful scheduling tools that can book immediately up to 30 days ahead. Reoccurring transport, for example, weekly dialysis, for example, track it from a dashboard. So those people that got to get their kidneys checked and blood clean, that's who they use. Now here's where it gets relates to the Uber app. It's where it gets so funky. Uber Health doesn't mean that every Uber driver becomes a medical trained transport provider. Ah, that's what they call it, medically trained transport provider. There are two big split worlds. There's the Uber Health dashboard, which now you know, and the regular Uber app. Now you know. So I was using Uber X as a regular Uber, and then there's the Uber dashboard. Now this lady said she asked me, "Can you walk?" And I said, "Yeah, I can walk a little bit, but I'm in a wheelchair." So there you go. So that is a thing. Healthcare organizations arrange transport. It doesn't rely on the customer's silver app. The ride gets delivered through a traditional Uber app, driver pool, or via specific NEMT partners. The regular app is Uber X. These rides still exist in the normal world. They're usually fully filled by standard Uber drivers, and that's kind of what it should be. Because honestly, the average, I'm there. All they do is put the light wheelchair in the back trunk, and if they can't lift a wheelchair, then they should be driving. That just be a few factor. Now, but it says your basic Uber X driver is not a sudden a trained caregiver. So we understand that. They're not. So, and I don't need that type of care. Okay. Uh-huh. Talk about okay, cool. Now, database says I want to be straight with you. Uh, I don't think this is fabrication. I think this information in Chat GBT is giving me is exactly correct. Drink more water as I go to the doctor for my kidneys and check my albumin and kidney function. I'm gonna pee tonight, boy. I'm gonna do a lot of peeing, baby. A lot of peeing. Praise God. Clean up. Yeah, I'm gonna make sure we keep our kidneys to the best of the ability we got. And so, what it says, what it says, as it fell down it one more time on this thing, it says this little catchphrase. It says, some riders and even drivers find Uber health confusing or imperfect in practice. That's okay. So this is really could be confusing. That is why I call the lady. That's why I look at black women and I say, you need to be like a white person and be trusting but fucking verifying. I'm a cybersecurity engineer. We want to trick and we want to protect everything. I want to protect the fact that you're calling an Uber for me and I get that Uber. I'm not going to miss a stupid Uber because you made a stupid mistake. You're going to give me what I need. I want it now and I get it now. But I have to verify that you're doing your job. You don't like that? Kiss my ass. You're doing your job. So it says drivers sometimes feel uncomfortable without clear medical support responsibilities. Yeah, I do. And that's true. And so that leads to cancellations, which is also that affects us. Next, patients can struggle to reach drivers after rise because Uber Health makes contact info mask the contact info for privacy reasons. Exactly. And that's why I asked the lady, who do I call to get it back? She says, call, have the nurse call her. Well, I got your Simmons number. And so now that I have her number, I'll be said, call this lady, she'll schedule me a ride. Now, where specialized services like WAVs aren't available, they can use regular drivers who are not equipped for all needs. Thank God I'm not that bad. I'm not that sick. But if you're that sick, then praise the Lord. These are systemic failures. These reflect the limits of integrating healthcare, logistics with the gig economy, and the lack of universal medical support standards for rideshare. This product is still evolving. So there's a website called ShiftBed, and it's already done some research on this. ShiftBed explains Uber Health integration to help eliminate the barriers between health system employees, for help eliminate transportation barriers for health system employees. This came on October 16th. Yes. So right when they canceled the whole NEMT on October 16th, this came out right then. Here's what it says as it's being written. Shout out to them. All right. On McLean, Virginia, ShiftMed, a leading AI-powered healthcare workforce platform, has expanded its integration with Uber Health to give health system employees direct access to transportation through the ShiftMed Flex platform. The feature enables hospital employed clinicians and staff, like social worker, to request Uber rides to and from shifts without upfront cost. And we know, let me be clear, a regular Uber to and from this place, $100, $100. Or you got to wait an hour for the Uber to come get you, and an hour for you to come back. So you're waiting, you're taking a basically 8 hour day. You got to get an Uber at 8 o'clock in the morning. If you get another Uber right back, it's going to be $50 for it, $50 back, $100 because you got a tip. You got a tip. This is the cut taken away from that. So what pissed me off about this whole thing is I wasted really out of the 7 months I've been here, I wasted 6 months fighting with this woman trying to send her messages after messages to go to the doctor that I'm supposed to go to, and she did not. But all that's been documented. All that's been documented. I dare her to come at me because I'm prepared for her. Now, it says 5.7 million hospital employees use these benefits. So they don't not only do they help the Hospital employees, they also help, like me, a person that is a patient. Let's keep reading. Okay, part-time and full-time staff, they use it. One in five workers needs it. So they're talking about these are workers, 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 workers. So this is called Shift Bed, and the website it's like for the nurses, Shift Bed. Okay. Um, that is the website, shiftbed.com. Now this is talking about the actual person that works at the hospital. We're talking about the patient going to the hospital. Now, the next thing it says, it's that it's not a standalone, it's not an app for you to download. Um, it's a healthcare sector tool by doctor, my care coordinator, aka social worker, insurance plan, and a community program has to order rides for you. See that? If you want support, if you want support, ask your care provider, ask your care provider if they offer Uber health transportation and whether they can schedule rides for you. If you have mobility needs, like a wheelchair walker, like me, ask for a waive or a third party NEMT. And I've already told her about the wheelchair, so that's what she's going to get. Expect text phone notifications, not push alerts. What that means will be it's going to come to my Uber, my Google Voice, which is already synced on my both of my phones. Bottom line, it's less about the Uber app, more like a logistics dashboard that adapts transport to reduce appointments, yada 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 yada. So let's see. I would like to ask a big question, and I'm going to ask this question because it's fascinating to me. Can you tell me when this started? What date, time, year did this new feature or program start in the United States? And what company started it? Outstanding. So now we'll get a little insight on the company while he's a PT. All right, here we go, baby. Yeah. So I would thank her. I'm sorry. That bathroom is so messed up because people be it's the most busy bathroom. You know, you got the women use it. Well, only one female used the bath or two. No, one, maybe two, two. I take that back one because I've never seen, with all due respect, I've never seen a black woman. Her name is Cadet ever go to the bathroom in that because she can't sit on the toilet because she can't move her legs, and I feel bad for her. I really do. But she, like I said, really, really needs to recognize that I know you don't, you are, you say you're a Christian, but you can't treat people the way you've been treating people. You got to recognize you treat people fair, and that's exactly what I meant. Now, here's a straight evidence-based history of Uber Health. They said it started, Uber Health was started by Uber Technologies when? March 8, 2018. March 2018. Uh-huh. Book rides on behalf of patients, even if the patients don't have an Uber app or smartphone. March 2018. So this is 2025. So it's been out for a while. Here's the website, and this is the actual article. Actually, the article came out in 2020, but it says it. Prescription delivery. Yeah, man. All right, well, that's all right. I got that. Cool. HIPAA compliant platform. Hospitals, clinics, and other organizations. Yes. Non-medical, non-emergency medical transportation. Yep, 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 yep. All right, so we got for clarity on that, guys. Good job for you to be able to get that clarity. And now I'll turn it over to some music and some worship as we talk about Christmas. And we praise God for His goodness. In Jesus' name. There we go. Mm. Oh, oh, Christmas. Merry Christmas. Yeah. Yeah. Sunrise. Ah, ah. All right, guys. As you hear that song, let it be encouraging and let you learn from my story, my situation, guys. This is just a great. This is two things that happened today. One, I got the ride for Wednesday. Two, they're already looking at me to drive my own vehicle. I have not received a letter yet. I've not received any call yet. They called me at 10 o'clock, Street 24. I'm waiting for a response. Give them time because I want them to tell me I'm wrong. But based on the ADA, I should have a right to get my vehicle here. Holiday to you, the holiday to you. Yeah, yeah. That's tight right here. Happy holiday. Yeah. Yeah, that's good. That's good. That spit is right. That's perfect. I like that key right there. I like that key. I don't know why it's a good key. It's a good key. That's a good key. Uh-huh. That is no addition, man. I don't remember the song. They were kids. We were kids. They were like a little bit older than I. Like I think they might be 5 years older than I am, to be honest, because 86 came, I was 12. So they had to be about 14, 15. To you. Happy holiday. Happy holiday. That's right.